Hospital stays are stressful at any age, but they can be dangerous for older adults. Hospitalizations are also expensive. Chronic care in hospital settings is one major driver of healthcare spending. Japan has sought to reduce hospitalizations for the elderly by providing care in the patient's home, focusing on preventative measures that keep people out of the hospital. But a workforce shortage could threaten the success of home-based care. For 90.5 WESA News, this is Designing Dignity, a series that explores some of the most pressing questions facing Pennsylvania. Are we prepared for an aging population? And how can we make sure older adults age with dignity? I'm Kylie Kaczynski. In Yokosuka, Japan, Kunio Koizumi was recovering from a fall in March when his care manager, Noriko Suzuki, arrived at his home on a Saturday afternoon.
Ohayou gozaimasu. Hi. Okay.
Koizumi is lying in a hospital bed in the living room watching baseball on TV. At 78 years old, Koizumi has dementia and a severe heart condition. Suzuki gets to work checking his temperature and updating a shared set of notes for the aides that visit every day. She checks to see if Koizumi has been taking his medication and eating his meal delivery that arrives in a bento box. Koizumi's older brother Isao is visiting as he does every day, but Koizumi says he should be the one looking after Isao.
He's been coming without fail every morning around 7, bringing me something to eat. He's my older brother. It's the wrong way around, isn't it? I'm the one being looked after.
Koizumi is one of many older adults in Japan who receive routine medical care at home. It's part of the country's strategy to reduce overcrowding at hospitals. It also allows doctors to spend more time with each patient. Dr. Kenichi Uchida arrives shortly after Suzuki to physically examine Koizumi. But he spends most of the visit talking with his patient. Uchida says home-based care changed the way he approaches medicine.
When I was a hospital doctor, I paid almost no attention to a patient's life history or personal background. There wasn't the time, and my focus was much more on being a craftsman, repairing organs.
He says making house calls required him to spend more time with patients and get to know them.
When you're working in a hospital, you're constantly looking for medical problems and working through them. That's critical. But when someone has come home, the medical aspect is only about 20% of the picture.
The rest is communication, social stimulation. Across town, Suzuki and Dr. Uchida visit the Tanaka family. Kunihiro Tanaka has dementia. Suzuki visits his home routinely, but she spends most of her time chatting with Kunihiro's wife, Yoshiko. As her husband's condition has deteriorated, Yoshiko says Suzuki's visits are a lifeline.
The time when Tsuyuki-san comes in is honestly my only real respite. That's the truth. Having someone to chat with, it really helps so much.
Giving caregivers an outlet is one of several tasks care managers like Suzuki take care of during a home visit. She's also updating notes in an instant messaging app shared by home health aides, care managers, and physicians. While home visits can keep the elderly out of hospitals where there's a risk of infection or delirium, a persistent workforce shortage in Japan is threatening the future of home-based care. Japan has implemented a specialized visa program designed to attract health workers from neighboring countries to boost the workforce. But becoming a certified care manager is a complicated process, and health workers must speak Japanese. Dr. Uchida says whatever strategies lawmakers come up with, the goal should be to maintain a high quality of care for all Japanese, regardless of income.
Whether you're the emperor or on welfare, you receive essentially the same treatment. That's the biggest difference between Japanese and American healthcare. Here, no one has to worry. Of course, the question of how to fund it is a major social issue, a political one that heavily influences elections.
Healthcare funding is a political football in the United States, too. We're just beginning to see the impact of federal cuts to Medicaid. Because it's the single largest payer for nursing homes, the future of Medicaid spending has a direct effect on elder care. Japan covers most of the cost of elder care through its national long-term insurance. Several states in the U.S. are exploring a similar program. The first in the nation will launch in Washington state next month. Will it help families cover costs? That's next time. Designing Dignity is hosted by me, Kylie Kaczynski, and edited by Glynis Board. Our executive editor is Cindy Lash. Our digital editor is Katie Blackley. Japanese translation provided by Shoko Plombeck. This series is part of a fellowship with the Association of Healthcare Journalists, supported by the Commonwealth Fund.